Hello everyone. So today in Lfs Clinical Surgery series, so we'll be discussing these three radiographs from a IVP series. So first is X-ray KUV. This is scout image, and we are not able to see any calculi or any calcification or any other abnormality in this. So it looks like patient is a well-prepared patient with very less amount of intra-bowel gas. And in second image is 10 minutes after IV contrast, and third image is 15 minutes after IV contrast. So this image shows this is renal outline. Okay, there is dilated pelvicalyceal system. This is dilated pelvicalyceal system, dilated proximal ureter with the uretary calculi mid-ureter. Fine. The left-sided system is normal, with left side normal ureter. In 15 minutes film, we can see the contrast has reached bladder also, and there is dilated pelvicalyceal system on left side along with proximal ureter dilatation. Okay. So what is the name of the investigation series shown above? This is IVP or IVU. So it is intravenous pyelography or intravenous urography. So what is your diagnosis? Diagnosis is mid-ureteric calculi. Mid-ureteric calculi with right-sided hydroureteronephrosis, as there is dilated proximal ureter and dilated pelvicalyceal system. So now third question is, how do you prepare the patient for this study? Okay. So first, adults. So first is, no solid food for at least 4 to 6 hours. No dehydration. The patient should be well hydrated. Third thing is low residue diet. The patient should be on low residue diet, and to take oral tablets of antiflagellant and purgatives a night before procedure, IVP. Okay. Then in children, no dehydration again. No dehydration. The stomach should not be full. Should not be full to avoid vomiting. Okay. Vomiting. And third thing which is important, then bowel preparation, colon should be empty. And how it is done? It is done with suppositories and not laxatives. Okay. So this is how it is prepared. Now fourth question is contrast. Which contrast is used? Okay. Which contrast is used? So we have ionic and non-ionic contrast. Okay. Non-ionic contrast. So in ionic contrast, we have sodium diatroetrizoate and meglumine iothalamate. Fine. And in non-ionic, we have iohexol, that is omnipaque, and the sodium diatroetrizoate it comes as urography. Fine. Now let us discuss dosage. So maximum permissible iodine is 300 milligram per kilogram body weight, with up to 600 milligram per kilogram in well hydrated adult patients. Okay. And maximum should not increase more than 40 gram. So maximum dose, it is 40 gram, should not exceed more than 40 gram. Now, so 60% of diatrozoate and meglumine iothalamate, so it is equivalent to 280 milligram per milliliter of iodine. Fine. And dose then becomes 1 to 2 milliliter per kilogram body weight. And for children less than 6 month age, so 10 ml is the maximum dose. 6 months to 2 year, 20 ml is, and more than 2 years up till the 10 year, it is 20 to 40 ml. Fine. It is 20 to 40 ml. So this is about commonly used contrast here. Then we have non-ionic contrast, that is iohexol. Fine. Now, so this was fourth question. Fifth question is how it is done, how this procedure is done. About this injection, so injection is given as bolus. So first we give about 1 ml as a testing dose to look for any reaction. So we wait for almost 1 minute. After waiting for 1 minute, if there is no reaction or any allergy, so what we do, we give a bolus in about 30 to 60 seconds. So it should be given fast in 30 to 60 seconds. Okay. And then imaging is done. One term here is nephrogram. What is nephrogram? Nephrogram, we have two phases in nephrogram. So one is cortical phase and one is tubular phase. So cortical phase, that is seen less than 20 seconds, and tubular phase up till 1 minute. Okay. So cortical phase less than 20 seconds, and this tubular phase up till 1 minute. Okay, so cortical phase is basically vascular filling, and the tubular phase is when contrast is within the lumen of tubule, renal tubules. Fine. Okay, so how patient is placed? So patient is placed in supine position first, and a scout film is taken, X-ray is taken, and X-ray is taken to look for calcification, to look for any stone, to look for any other pathology, and then after that contrast is given as I explained. Okay, first I will discuss in neonates. Okay, in neonates. See, in neonates, the concentration ability of the kidney is not fully developed. So first film here, which is taken at 15 minutes. Fine, 15 minutes. So first film is taken at 15 minutes, important. And then minimum number of films are taken. Minimum number of films are taken. Okay. One more thing, gonadal protective shields are used. Okay. Then how to negate the bowel gases here? Bowel gases. So we do paddle compression. Fine. Paddle compression or prone position. Okay, so after neonates, then adults. In adults, what we do, we take a scout film, X-ray KUB, scout film, and then we take at 1 minute, 5 minutes, 10 minutes, 15 minutes, 35 minutes, post-void films, and later on delayed films. Fine, and then delayed films. Okay, so at 1 minute it is nephrogram phase. Nephrogram. At 5 minutes, what we can see nephrogram, pelvicalyceal system, and proximal ureter. Then, for better visualization of pelvicalyceal system, at 10 minutes we can do abdominal compression. Okay, abdominal compression. But it is contraindicated in some cases, like in abdominal aortic aneurysm, in case of obstruction, in case of trauma. Okay, then so for after visualization of pelvicalyceal system, then at 15 minutes the position is prone. Okay, 15 minutes position is prone position. Fine. Then this is for better visualization of ureter. Better visualization of ureter. Okay, for better visualization of ureter. So we take 35-minute film. So we can see kidney, ureter, and bladder. Then is post-void film. Besides, we can also take micturating films in oblique view. Okay, so post-void film we can see residual urine, and urinary bladder mucosa, diverticula, growth, outlet obstruction, and vesico-ureteric reflux. Okay, so this is seen in post-void film. Delayed films. So they are taken at 1 hour, 3 hour, 6 hour, 12 hour, and 24 hours. Okay, so they are used in case of obstruction, because we can see nephrogram here, but we will not be able to see pelvicalyceal system. Fine. Then long-standing hydronephrosis. Again, here we will be able to see renal parenchyma, but not pelvicalyceal system. Fine, but not pelvicalyceal system. Third thing is congenital conditions. Okay, congenital lesions. So we are not able to see upper calyceal system. Or in case of atrophic or non-functional kidney. So children, film are taken at 2 minutes, and this film is supine film, and then at 7 minutes this film is prone. So this is taken in prone position. Then one more thing, for better visualization of left kidney, so carbonated beverages are given. And for better visualization of right kidney, 15 to 20 degree caudal tilt. caudal tilt. Okay. Contraindications. First is anaphylaxis history. Second is history of generalized allergy or iodine allergy. Fine. Third thing is hepatorenal syndrome. Fourth thing is renal failure with serum creatinine more than 1.5. Serum creatinine more than 1.5. And fifth is multiple myeloma. And sixth, pregnancy. It is contraindicated in first trimester because of radiation exposure. Okay. Then seventh is infancy, because it is not well developed, renal system not well developed for excretion. So infancy. Then eighth is hyperthyroidism. And ninth is diabetes. Okay, so this is all about all the question asked in this radiographic series. So this was IVP, and diagnosis was mid uretary calculi with right-sided hydronephrosis.